Your prostate gland is about the size of an arecanut seed or walnut seed, situated at the bottom of your bladder in front of your back passage. The urine outlet from the bladder, called the urethra, runs through it. The main function of the gland is to secrete fluid along that nourishes and protects sperms manufactured in your testicle. In most people, the gland gives no problems, but in some, it can get inflamed like any other gland in your body. This inflammation caused by bacteria is referred to as acute prostatitis. As you age, the prostate naturally gets bigger, and in most people such enlargement gives no problems. It is referred to as benign prostatic hypertrophy. When the lateral lobes of the prostate gland grows outwards, it causes no problems to the urethral tube that runs through the middle of the gland. But if the enlargement occurs inwards, causes obstruction to the urinary passage. Early symptoms of this situation are that you get up in the night time a few times to pass water, or you may be finding it difficult to pass water, or you empty your bladder incompletely. So if you have any of the above symptoms in your middle age, please see your doctor. Your doctor in the examination process will insert a finger in your back passage and feel the gland to check whether it is enlarged. You get a great feeling when the doctor does this per rectal, or as we call PR examination. There's a joke that these days doctors insert two fingers, not one. The second finger is for a second opinion. Benign enlarged prostate does not cause cancer. This is a fear in most people. If the prostate gland is enlarged, causing urinary tract discomfort as described before, there are natural prostatic remedies that reduce the dihydrotestosterone or DHT that causes the problem, such as palmito, beta-sitosterol, pumpkin seeds, and vitamin B6. The drugs Avodart and Prosca also reduce the DHT levels. In the past, we enucleated the prostate gland through a cut in the lower abdomen called the Millin's procedure. Today, it is done through a laparoscopic procedure. About 1 man in 9 will be diagnosed with prostate cancer during his lifetime. Prostate cancer is the second most common cancer diagnosed in men in Australia, and the third most common cause of cancer death. 1 in 6 men will be diagnosed with prostate cancer by the age of 85. It is more common in older men, with over 63% of cases diagnosed in men over 65 years of age. Prostate cancer grows very slowly and is initially confined to the prostate gland because the gland is enclosed in a thick fibrous capsule. When the condition is detected early and confined to the prostate gland, has a good chance of successful treatment. The two most common tests to check whether you have cancer of the prostate gland, your doctor will do a digital rectal examination as done for benign prostatic enlargement, and the prostatic specific antigen test called the PSA test. The antigen, a protein, is virtually produced only in the prostate gland. It is produced by the normal gland and in cancer of the prostate gland. Warnings regarding the testing of PSA. Before 48 hours your PSA test is done, you should not ride a bike, motorcycle or a tractor. You should not participate in vigorous exercise that could jostle the prostate area. You should not have a digital rectal examination for 48 hours by the doctor. Do not have sex for at least 24 hours prior to the test. The test is done on a sample of your blood. The test is useful to diagnose early prostatic cancer and also monitoring its treatment. The normal range of the age-specific PSA is 0.4 Ng per ml. The normal prostate gland secretes this chemical right through one's life. It gradually increases yearly and could be variable. For men under 50, healthy PSA levels will usually range from 0.3 and 2.5 nanograms per milliliter. In the presence of cancer, PSA levels can rise to up to 160 nanograms per milliliter. In men between 50 and 60, healthy PSA levels will usually range from 0.3 and 4.7 Ng milliliters. Men over 60 to 70, the healthy PSA levels will usually range from 0.3 and 8.3 Ng per milliliter. For men over 70, healthy PSA levels will usually range between 0.4 and 17.8 Ng per milliliter with an average of 8.9. The protein antigen can rise dramatically in the presence of prostate cancer. PSA levels can rise with benign prostate hyperplasia or hypertrophy and also with infections in the gland called prostatitis. There is a problem with overweight people. They could have cancer of the prostate gland with a low PSA levels. PSA test is controversial because there are cases with false negatives and that could affect the management. When it comes to the management of prostate cancer, the treatment assessment is according to the staging, which communicates how advanced the disease is and to help treatment. In stage 1, the cancer is restricted to one half of the prostate with no spread and the PSA level is below 10. Stage 2A, the tumor is still restricted to one side of the prostate and the PSA level could be less than 20 Ng per milliliter. Stage 2B, the tumor has spread onto the opposite side of the prostate. Stage 3 and 4, the cancer has spread and quite advanced. In most cases where the PSA level is not too high in prostate cancer are left alone and only observed. The reason is invasive procedures can harm and the morbidity figures do not show better results than no treatment and just observation. For this reason, the U.S. Preventive Services Task Force now recommends that men aged 55 to 69 decide for themselves whether to undergo a prostate-specific antigen or PSA test. After talking it over with their doctor, the task force recommends against screening for men over 70 because the potential benefits do not outweigh the risks. People who eat a lot of tomatoes are less likely to get prostate cancer. Lycopene, an antioxidant found in tomatoes, seem to decrease cell damage and slow cancer production. Broccoli and other crucifers, including cauliflower, cabbage, Brussels sprouts, and kale, contains complex compounds that may help protect against cancer, including prostate cancer. Green tea seems to reduce the risk of prostate cancer. Phytoestrogens found in beans, peanuts, and lentils seem to reduce the risk of prostate cancer. Omega-3 fish oils and fish in general may be beneficial to prevent prostate cancer. The bottom line: every male after the age of 50 years should be aware of the risk of having prostate cancer. Annual PSA testing on your blood is recommended, especially for those having a family history. Management and preventive measures have been discussed. Hope this article was useful. Thank you for watching this video. Stay safe until we meet again. Bye for now.